Hello, my name's Christina. I'm going to be taking over for your nurse while she's at lunch. Can you please tell me your name and date of birth?
I get asked this question every single time somebody comes in here. Taylor Murray, 4898.
Thank you. I know it's annoying, but it's part of our safety protocol. How are you feeling today? Do you have any pain from your knee surgery?
No, I'm not in any pain right now.
Okay, well please feel free to let us know if that changes, alright? Your doctor has ordered heparin therapy to begin today, and it's time to administer your first dose.
Heparin? What is that?
Heparin's an anticoagulant that, in your case, will help reduce the risk of blood clots. Since you've just had surgery and you're going to be in the bed in a few days, you have a high risk, so we just want to reduce that.
But what are anticoagulants?
Drugs that prevent the formation of a clot by inhibiting certain clotting factors are called anticoagulants. These drugs have no direct effect on a blood clot that has already formed. They prevent intravascular thrombosis by decreasing blood coagulability. Their uses vary from preventing clot formation to preventing the extension of an established clot or thrombosis. The ability of anticoagulants to prevent clot formation is of benefit in certain settings in which there is a likelihood of a clot formation. These include MI, unstable angina, atrial fibrillation, use of indwelling devices such as mechanical heart valves, and conditions in which blood flow may be slowed and may be pulled, such as orthopedic surgery or prolonged periods of immobilization like hospitalization or even long plane rides. The ultimate consequence of a clot can be a stroke or a heart attack, a DVT, or a PE. Other type of anticoagulants include heparin, warfarin, direct thrombin inhibitors, and selective factor inhibitors.
Do anticoagulants have any side effects?
While many drugs fall under the class of medications known as anticoagulants, contraindications and adverse reactions remain the same across the class. Common contraindications include a known drug allergy to the drug or its ingredients, acute bleeding events such as with hemorrhagic stroke, or personal increased risk for acute bleeding events, such as with some genetic disorders. For warfarin specifically, its use is contraindicated in pregnancy with the use of low molecular weight heparin and for individuals with an indwelling epidural catheter due to the risk of hematoma formation. Other types of anticoagulants are used very cautiously in pregnancy. The most common side effects of anticoagulants include an increased incidence of bruising and delayed coagulation of traumatic bleeding events. Serious adverse reactions include severe bleeding events, hematoma formation, prolonged nosebleeds, hemoptysis, and indications of GI bleeding such as hematemesis, rectal bleeding, or the presence of melena. Special considerations for heparin include the risk of heparin-induced thrombocytopenia or low platelet count, which has two types. Type 1 has a gradual onset. Heparin therapy can be continued with platelet levels closely monitored. Type 2, however, is acute, with a dramatic fall in platelet count of more than 50% from baseline. Heparin therapy must be discontinued, placing the patient at an increased risk for thrombus. Specifically for warfarin is the concern for the condition known as purple toe syndrome, which results in necrosis of tissue around the toes.
I don't really know if I want to take this medication. I've seen a lot of lawyers and everyone on TV, and they just always talk about how dangerous these medications are, and this is just not where I wanted to die.
While every medication can come with risk, let me explain to you how you and your healthcare team can keep you safe while on this medication.
Inform the dentist when taking an anticoagulant. Dental procedures can cause bleeding, so the dentist may need to contact a healthcare provider. Use a soft toothbrush when brushing to prevent gums from bleeding. Bleeding from cuts caused by shaving may be difficult to control. If bleeding occurs, apply firm direct pressure to the bleeding area for at least 5 to 10 minutes with a clean, dry, absorbent material. Carry a medical identification card with your name, phone number, and the drug that you're taking with you at all times. Herbal products interact with anticoagulants and may increase bleeding. Be sure to rotate your injection site. Report any frank bleeding, such as nosebleeds or bleeding gums.
Do you have any other questions I can help you with?
No, I understand that this medication will help keep my blood from clotting. I'm comfortable with taking the heparin.
Well, I'm glad I could give you information to make you feel comfortable. The needle used for the heparin is small, and it's going to go into your stomach for the best effect.
Excuse me, a needle?